Hi everybody, I'm Dragonborn and this is Surgeon kinda like simulator. And we're doing a visual root canal surgery. The reason I'm doing these surgery videos because it's something to have a laugh and have a joke about.
Welcome to Surgery Squad's virtual root canal procedure. I'm the one and only Dr. Jeff, and I'll be helping you with this surgery today.
Cool.
A root canal is an endodontic dental procedure that's used to repair and save a decayed or infected tooth. During a root canal, your dentist or endodontist will remove the pulp tissue within the tooth. Once everything is removed, they'll clean out any contaminants inside the tooth and seal it to prevent any further infection. Our patient today is having a root canal performed on their lower right second premolar. A dental professional may refer to this tooth as tooth 29. Before we begin, would you like to review some of the common myths and misconceptions surrounding root canal treatment?
We might as well have
I thought so.
Right, read the myth and click to move forward. During a root canal treatment, the tooth roots are removed.
Not even close. Remember, a root canal only involves cleaning, disinfecting, and sealing off the inside of the tooth. If the tooth's roots were removed, it would no longer have anything to anchor it to your jawbone.
If a tooth doesn't hurt, which my mouth now feels weird, it doesn't need a root canal treatment.
Not true at all. It is very possible for a patient to require root canal treatment if they have never experienced pain from a tooth. This is why having routine dental exams is important.
Always look after your teeth. Always brush them every morning and every night. Pulling a tooth is better option. Sorry. Pulling a tooth is a better option than having root canal treatment. Yeah.
Often patients may choose to have a tooth removed instead of having a root canal. While this may immediately seem like a simpler and more economical choice, it's often the opposite. Having a tooth extracted and replaced with a bridge, implant, or removable partial denture is not only a more costly option, but it also requires more treatment time.
I've had to have a few teeth of mine removed that I have, and I know it feels sad and ragging you about and punching your jaw in and torture you with needles and that. I know what it's like. Teeth that go through root canal treatment are eventually lost or pulled, so it's like they said, it's better off you having them out. I got offered root canal treatment, but I said no, just pull them out.
Not exactly. With positive oral hygiene habits such as routine brushing, flossing, and dental cleanings, most teeth that have root canal treatments can last your entire life.
I need to make sure my webcam's working. It is. So like I just said, hygiene. Root canal treatments requires multiple appointments to complete.
There is some truth to this statement. The number of appointments that are required to complete your root canal treatment depends on a few variables. These include how your dentist has been trained, their experience, equipment available to them, and the condition.
You know what?
Let's move on.
Shall we just get on with it?
In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. This will help reduce any discomfort the needle may cause.
They never did that to me. They never used numbing gel, just put the needle straight in and went, there you go. I never got this kind of treatment. Where's Tom moving then? Am I doing it?
Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums, just below the tooth we'll be performing a root canal treatment on.
When I had the anesthetic, it did last a few hours. But also, because I had a teeth pull out, I lost a lot of blood, which made me shake and have pains and everything else. But I never got the numbing gel, I just got straight anaesthetic. Wait 2 minutes, then it happened.
Let's give our patient a few minutes to relax and for their mouth to become completely numb.
See, I had to have one from this side and one from the other side. For this side, you can't do both sides because you can swallow your tongue because you can't feel your tongue as well. I know these things.
Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber dental dam and place it over the tooth. Once the rubber dam is in place, put on a tooth clamp to keep it from moving.
This is going to get technical, so if you're squeamish, look away.
Next, we'll need to dry out the tooth as much as possible using our air-water syringe. So far, so good. Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill.
Oh, the drill. Get ready, people. I never had that.
The next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot.
Go ahead, give it a shot. That, you know, you've all seen Outlast, haven't you? This is like Outlast. When they used to,
At this point, the dentist would measure the depth of the canal using a combination of X-rays and specialized equipment. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection. Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach.
They're putting bleach in someone's tooth. Oh, the sound.
We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved.
I'm glad I got all my teeth.
Great.
Pulled out, you know.
Now use the suction to remove the bleach from the patient's tooth.
I mean, this is torture.
Next, we'll need to fill the tooth using a rubber compound known as gutta percha. Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the gutta percha cone. Let's see what you can do.
Well, I'd use gasket sealer, or bathroom sealer, or exhaust sealer. Don't listen to. I'm so-called doctor. I'm not a doctor.
Looking good. A heated instrument is now used to remove the excess gutta percha.
Why can't you just rack it out? Go like that.
Pack the gutta percha into the tooth canal using a plugger.
What the fool? Oh.
After the gutta percha has been placed, it is common that additional X-rays are taken to verify that the canal has been adequately sealed off. Once the dentist verifies that the canal has been sealed, a filling or crown is placed, depending on the location of the tooth. You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown procedures here on SurgerySquad.com. After a root canal, patients should expect some mild sensitivity and discomfort. This can usually be relieved using over-the-counter pain medication, such as ibuprofen or naproxen. By brushing twice a day, flossing daily, scheduling regular dental visits, and avoiding smoking, it is possible to greatly reduce the need for a root canal.
Don't do drugs and don't.
And that's a root canal. Why not check out some of our other amazing surgeries here on SurgerySquad.com.
Oh my God. that was teeth, anything to do with the face, no way. Body, hands, knees, whatever, don't bother me. But when it's, oh my god, it's indescribable, especially when I talked to my next door neighbour about how he goes to the dentist and he has to have a few needles in, and he was telling me how it does it, and it's like, no. Even though I've had it done myself, if my mum went to the dentist, she struggled big to have an anaesthetic because the anaesthetic does not work with her. It'd work for like about 10 seconds, and you know what I mean. So if she ever has to go to the dentist, they probably have to knock her out clean out by putting her to sleep. So brush your teeth. I mean, I do, and I mean I really do. My parents think I don't, but I do, secretly. But anyway, this is carpal tunnel surgery. No idea what it is. I think it's something to do with your hand. I thought I might as well do 2 videos, and then I'll move on to the,
Welcome to Surgery Squad's virtual limited open carpal tunnel release surgery. I'm Dr. Jeff, and I will be guiding you through the procedure today.
Cool.
Carpal tunnel syndrome is characterized by a tingling numbness or pain in your hand, and sometimes forearm. It develops due to the swelling of a ligament in the wrist known as the transverse carpal ligament. The swelling of the transverse carpal ligament creates pressure on the median nerve in your wrist. This nerve is responsible for supplying feeling and movement to various parts of the hand. Performing repetitive motions with the hand or wrist over a long period is the main cause of carpal tunnel syndrome, and the condition is more commonly seen in women than men. Researchers have also discovered that other medical problems such as alcoholism, arthritis, diabetes, obesity, and infections could also lead to carpal tunnel syndrome. Today we'll be operating on a patient who has been diagnosed with carpal tunnel syndrome after experiencing numbness and weakness in the palm of his hand and thumb. Now let's put on our gloves and get started.
Yeah, let's get on our gloves and get
started. The
limited
open carpal tunnel release surgery is performed using a local anesthetic that numbs the carpal tunnel area of the hand and wrist.
So
if a patient is nervous or uncomfortable, I'll sometimes use a sedative as well.
Ooh.
A sedative is a drug given through an IV that places the patient in a dreamlike state. However, our patient today will only receive the local anesthetic.
Oh, right.
Go ahead and get the operating area numb.
Fine. Puff. Puff. Puff.
With the wrist anesthetized, we can now begin the operation. I've already tied a tourniquet around the patient's upper arm.
Oh,
Can you go ahead and outline where we'll be making our incision?
Yes. Something like that. Something like that. Yeah? Sorry. Oh, I can't tell it's like this. Oh,
looks good to me. We'll be making a 3/4 inch incision at the intersection of those lines.
Right.
Now take the scalpel and make the incision.
Oh, I hope it is
nice. I couldn't have done it better myself.
Nice.
Now we'll spread the incision wider to expose the transverse carpal ligament. This band of tissue is the cause of the problems. Place the retractors into the incision and spread it open.
Give him the clamps. Oh,
I think you're a natural at this. With the transverse carpal ligament exposed, I'll need you to slip a carpal tunnel guide into the incision. This is a blunt-tipped instrument with a groove on the upper surface to accommodate a special knife. The carpal tunnel guide is placed down the carpal tunnel and underneath the ligament and is used to protect the underlying nerve and tendons. Go ahead and push the carpal tunnel guide into place.
This might be a 30-minute video, so I just thought I'd just do one. Then, after this one later on down the line, I'll do the A10 ones. I think it's Dr. Susie or whatever. I didn't realise these were so long. You see, so
once it's in position, you'll advance our special knife down the guide to split the carpal ligament. As you push the knife forward, you will feel it cutting through the carpal ligament.
it's nasty. Oh.
Perfect.
Check it out.
With the transverse carpal ligament cut, the median nerve is no longer inflamed. Now we can begin to clean and close the incision. Go ahead and irrigate the wound.
Oh, this is bad. This is terrible. This is terrible.
When you're finished, I'll release the tourniquet, allowing blood to flow back into the hand. Great! Now you'll close the wound using non-absorbable sutures.
And that's it.
With the wound closed, we'll inject additional numbing medicine around the operating site to help relieve some of the immediate pain the patient may feel after surgery.
Yes, we will.
And lastly, we'll place a small dressing over the wound to absorb any residual blood. We'll immobilize the wrist with a splint and a sling, and after 1 to 3 hours, our patient is sent home to recover. Our patient needs to keep in mind that because of some of the medications we used, he may experience a bit of nausea. He will also be given pain medication to help relieve the discomfort he'll feel in his wrist. Once our patient returns home, he'll be asked to follow specific instructions for driving, exercise, and medication. This will include keeping his hand elevated above his heart for the first few days after surgery. About 2 weeks after surgery, we'll remove our patient's stitches, and he'll be gradually allowed to return to his normal routines in 4 to 6 weeks. And that's a limited open carpal tunnel release surgery. Thanks for stopping by. Why not try out some of the other amazing surgeries here on SurgerySquad.com?
No, we're done. How to cook a turkey? Oh, I didn't know they were cool. I didn't know they do food. Huh. I'll have to give that my big sister, but we don't tell that. Shh. Anyway, I'm gonna leave this video here. I'm done with this surgery. I'll probably do some more, but like I said before, from the A10.com. Because they're a lot shorter and I can get 3 done. If I do another one, it's going to be like 40-minute video of 3 surgeries, and you know, within like 20 minutes I could do about 4 surgeries. Do you know what I mean? So anyway, thank you all for watching. I hope you liked it, because I bloody didn't. But anyway, people are going to ask me why you're playing these videos. It's just a bit of fun. But anyway, thank you all for watching, and I will see you in the next episode. Bye bye. And please do not try this at home. And I mean, really, don't.